I'm going to be telling you 12 things that you need to do if you are diabetic that will help you. Especially, you know that diabetes can destroy your kidneys over time. It reduces your kidney function over time, even your drugs too. So these are the things that you must do. If you have a relative that is on diabetes, your mom, your father, please make sure that they watch this video. Number one, please make sure that you do urinalysis every 3 months or 2 months. Try to do urinalysis. Now, urinalysis shows you if there are abnormalities in your urine. For instance, protein. If protein is found in the urine, it shows that something is happening to the kidney, and proper medical check would take place. So you have to check your urine, do urinalysis, okay, every 2 months. It now depends, okay. Number two, do kidney function tests. Now, kidney function test checks your kidneys, because diabetes, as you're having diabetes, your kidney functions is reducing. You can do this test and send to me on my Instagram page. I will answer you, or send it to your doctor, or let your doctor know. And also, the drugs you're taking, it also reduces your immune. It also reduces your kidney function a little. It also relates to high blood pressure too. So this is why you should take it very serious while managing your diabetes, and don't just leave yourself. Number three, please try to check your eye. Go and see the doctor that sees the eye at least once or twice every month, depending on the first time you went to see him, what the result is. Diabetes, it impairs with the nerves when your sugars are so high in your eyes, okay, so that you don't get blind all of a sudden, okay. Most people see signs, why some people don't see, okay. So make sure you see an eye doctor at least once or twice every year. Number three, we'll talk about food. Number five, yes, food care. Now you need to take care of your feet. People that have diabetes, especially when it's poorly controlled, they the way as I don't know how to explain it. The way they feel things, the nerves that transfers pain is reduced. They don't really feel pain like before. This is called diabetic neuropathy. So you need to protect your feet, because most people, they will even have piercing in their feet, and they will not know that something pierced them. And because wound in diabetes is very hard to treat, when your sugar level is high, but if it's managed, no problem. So most people, they don't even know, because they've lost that sensitivity, and that wound will start becoming, it will exacerbate. You see your leg becoming swollen, start smelling, becoming black, and before you know it, they will tell you the doctor will have to amputate it or cut it off. So this is why you need to do foot care, okay. Let me tell you how to take care of your feet if you're on diabetes, because if you don't do these things, you might be exposing yourself to cutting off your leg, because you don't take care of your feet. How to take care of your feet on diabetes. Numbers, having known about one, make sure you wear stockings, okay. Wear socks if you're at home. And if you're always feeling heat in your leg, no problem, don't wear socks. But don't go barefooted. When you go barefooted, you can enjoy yourself. Something can prick you and you may not even be aware. Now try to wear shoes that are open. Don't wear shoes that are tight. Shoes that their mouth is that is too tight on you. That's another one. But don't wear shoes that are closed, okay, like cover shoes. No, wear shoes that your leg will always be visible, so that there will be air entering and you won't have blisters and sores. Because when you have heat, because of the heat and tightness, you might have blisters, and from there, wound. You don't get wound with that. You get. So make sure you wear shoes that are open fitted, that are loose. And whenever you sit down, don't put your leg down. Try to elevate it on something, so that there will be much blood supply to the leg, okay. Elevate it a little bit. Don't just sit down the way I'm sitting down. Put your leg on a small stool, okay, to elevate blood to your legs and also to your heart. Now, very, very important is this. Try so much to check your liver too. Make sure to do liver function test, okay? At least once or twice in a year. Depends on if your liver is okay because of the drugs you're taking too, okay? Now the next one is, make sure you check your blood pressure all the time. Try to check your blood pressure because of these drugs too, like I explained initially, okay? Check your blood pressure, because when your blood pressure comes up and you don't know, that one will destroy your kidneys without a twinkle of an eye, okay? Please, routine blood pressure monitoring. If you have the machine in the house, beautiful. The next one is ECG. Try to check your heart every year, at least once every year. This test is very paramount, and the name is electrocardiogram. It checks how your heart works, if your heart is okay, if there's anything going on with your heart, so that you don't have this history of people just slumps and die, or you hear somebody have a heart block or heart failure. They find out what is going on with your heart, and the doctors will deal with it immediately. Another one is, try to get a nutritionalist, okay, to help you with the food you take. If you can't, I've made a video on African foods, but what to take, the things that you can swap. Instead of taking this milk, take this. Instead of taking sugar, take this. It also is here on my YouTube page, so you can locate it. Also, some food you can use to, African foods. I'm also going to make a detailed video, but you don't rely on me. I'm not a nutritionalist, but this is good. You can get somebody that will coach you on food to take, nutritionalist, okay? So that you'll be managing this thing, and before you know, if you're able to manage your blood, things you eat, your sugar level will start coming down. If you're taking food, your drugs maybe 3 times, you find out that you'll be taking it like once, because of the way you are managing it with food, okay? So this is very, very important. Now the next one is, you can also try to see a dentist. I know this is very hard because of the money involved, but once in a year, so that if there's anything going on, you will know, because having wound there, is another complication, because wound healing is very hard in diabetes. So try to see a dentist at least once in a year to find out if anything is going on with your teeth. Now the most important thing is, do not skip your drugs. If your drug is about to finish, don't allow them to finish. The small time that you say your drug has finished 2 days and your blood pressure and your sugar level is 300, that time that is your sugar level is high, something is going on your kidneys. Your kidneys are being destroyed. So don't even allow your drugs to finish before you refill them. Your drug will finish in the next 3 days. Refill them before it finishes, and mind the way you eat. Do not leave yourself, because if you leave yourself, you will not like the outcome, okay? You will not like the outcome. The complications of diabetes have, from the videos from the first time, we know that, your eye, kidneys. So these things are things that you need to take serious and make sure that you manage yourself, okay? Now the next one is, do not starve yourself. Please don't starve yourself because you're diabetic. Don't starve, okay? Try to eat food in the morning, okay? You can a little bit, just small food, but don't starve yourself. It causes more harm to you than good, especially if you're diabetic. In the morning, take your drugs in the morning. If you want to shift it a little bit, you can take garden egg. Just make sure something is in your system, then maybe you can now eat your food later if you're not feeling hungry, okay? And if you have any other illness, any other underlying condition, make sure you treat it. Make sure, do not hold on. I know praying works, but don't just leave yourself uncared for, okay? So like this video, share, let me know if you have questions, okay? And have a nice day. Don't forget to subscribe, please.